Hi, this is Dr. Mark Santa, and welcome to today's Level Up podcast. This is the podcast that connects you with the ideas, the strategies, the individuals who are going to help you bring your practice to the next level. And I am stoked today to have my good friend and breakthrough coach, John Prather, with us. And the Prather family has a great long history in chiropractic. They have been pioneers in the chiropractic industry and transformed chiropractic. And I always like to say, God forbid anything happens to you, you want to have the Prathers check you out to see what's going on. And they've helped literally countless folks over the years find health and vitality and life in their practice out there in Indianapolis. And
Yep.
John ran that practice for many, many years.
Mhm.
And in addition, he is a cybersecurity expert and has developed a cybersecurity team that can help docs in their practice. We like to say, in terms of cybersecurity, you don't know what you don't know. And
Yep.
John, many of our docs think they've got it all buttoned down,
Yep.
and maybe they don't. And
Absolutely.
so John's going to help us with that. And hey, John, thanks for your time today. I appreciate you being with us.
Hey, I appreciate you having me. I've known you a long time. Like my dad's been a part of breakthrough coaching since the beginning when you had
Yeah.
the paper files before everything was online. You've gotten to see me grow up. I've always had the beard though. I mean, ever since a child. No, I'm just teasing.
That's
But
awesome. I,
so I appreciate you having me. And yeah, with when it comes to cybersecurity, we'll talk about some myths today. We'll talk about how to protect your practice, some things that cybersecurity insurance looks for, and how to be proactive there, some misconceptions, so on and so forth. And
oh, yeah.
the
And
reason why I start, go
I
ahead.
was just going to say, more than ever, this is something that comes up in our coaching conversations, unfortunately, on a very, very regular basis.
Yep.
And gosh, this is something that I hope you pause, take some time, really listen to what we're going to share with you today and what John has to share with you, because this can really make the difference in your practice being solid, protected, recovering post
Mhm.
any type of a cyber attack. And this is very important information for a doctor
Absolutely.
to know. So
There's
thank
two
you.
types. There's two types of docs out there. Ones that take cybersecurity insurance or cybersecurity seriously,
Yep,
and those that will be taking cybersecurity seriously.
exactly.
It's not something that's going away anytime soon, and it's only getting more and more aggressive, especially with AI out there.
Yeah,
They're creating new scams every single day,
yeah,
whether it be the elderly, whether it be, the toll booths for instance. There was a bunch of text going around, and you clicked that
yes,
link and downloaded something on your phone, and there's all these different things. And what got me into this, I really focus on small to mid-level practices. Now,
hmm,
hospitals have started, even with their IT team, have brought in cybersecurity experts and
sure.
even have their own teams.
Hmm.
And I ran with my dad's practice that you talked about earlier. I ran the HIPAA compliance, and there was a lot that I learned. There was a big learning curve, and I thought it was just something that people know. And as I was, getting to know more practices, seeing what they had implemented and in place, I haven't been to a single practice that actually meets even minimum standards when I do these audits, these free audits that I check for people.
Yeah,
It's concerning, especially since medical is the number one focus when it comes to ransomware, when it comes to cybersecurity terrorists, so on and so forth. Like they love medical because you have to be able to operate. They love taking the information, holding on to it, being able to resell that information because they can get a lot of info from medical right from the get-go.
especially
Um,
especially when they get a young patient,
mhm.
right? Uh,
Absolutely. Yeah, I'm
they,
going to talk on that as well. I
gosh,
mean, the rate for, 18 and younger, if you get medical info there, it goes I mean, 20 to 30 times more on the black market than it does for an adult, just because, again, it's you get more with it,
Yeah.
and you have longer time to really, work with it, take out credit cards, loans, all sorts of
And sit
info.
on it and sleep on it, which
Absolutely.
they do for years, right? So you
Oh
think,
yeah.
oh,
Yep.
everything's all good. And
Absolutely.
then,
I
yep,
mean, even in the unfortunate reality, even with sex trafficking rings, like this is something that you have
yeah,
to be proactive as. You want to be proactive as a parent. I have two young boys myself.
yep,
I always want to make sure that they're protected. And when info gets out there, it can be used in many nefarious ways. So, yeah, yeah. And
absolutely.
so, again, I really want to help mid to small level practices because you've talked on this. I agree with you. I think it's ridiculous that you have to meet the same standard that a hospital meets
But you
as,
do.
a
Yeah,
one
do.
practice chiropractor.
Yep.
But you do. You have to have the same standards, the same policies and procedures in place to really make sure that you're protected. So, across the board, no matter your size, you have to meet those same standards. So, we're going to talk on
Mhm.
that today, give you some ideas of how to be proactive with your practice. You can have your office administrator listen to this. That's a great person to have listen to this to make sure that your policies and procedures are where they need to be. And so we'll kind of dive into the slides and don't hesitate to ask any questions as we go. Okay.
Awesome. Thank you.
So, on average, this is according to IBM,
Hmm.
across healthcare, no matter what your size, the average cost for a ransom attack is $11 million. Now, I don't know about you, but I don't know a single private practice that has $11 million to spare.
That's
And
right.
so that is the average when it comes to your cybersecurity insurance payout, when it comes to the ransomware, when it comes to the loss of patients. They factor all that in, and you're looking at, I know it seems like a high number, but this is the factual truth of $11 million dollars is the average cost for just one hit, one attack, one wrong email
Yeah.
clicked open.
Yeah. That'll open your eyes.
Yeah, yep. And so that was according to IBM in 2024. And like I said, it's getting more aggressive. That number is only going up.
Yeah.
So 73% of healthcare organizations were hit by ransomware in 2023. IBM also said over a 3-year period, there's a 100% chance of you getting hit in some capacity. So it's one of those things where it's not a matter of if, it's a matter of when.
Hmm.
And and the numbers only growing and how they're doing it, they're getting smarter with it. And again, the human error, just clicking the wrong email and they're into your system. And we've even talked about before, there's been a client that through their printer
Yeah.
got hacked.
Yep.
Anything that's connected that's internet facing is an opportunity for them to get into your system. That includes your cell phones. People don't think of their cell phones as a mini computer, but that's what it
Hmm.
is. There's data on there. If you get on like a Starbucks Wi-Fi and someone gets into your phone and then you go to the office and you're on the office Wi-Fi, that's a way that they can access into your patient information. So you got to be very proactive. And there's just things you don't think about. And so that's really what we help with is being proactive, looking for
Yeah.
redundancies. That's
Yeah.
the thing. There's no such thing as a perfect plan. You're going to get hit. It's the redundancies and what you have in place that are going to protect you and save you at the end of the day.
Right on.
So average downtime, you're looking at 19 days is the average downtime right now. And that's a big chunk of change when it comes to your practice that you're losing
Right.
out on. 60% of breaches happen in practices with 100 employees or less. A lot of people think they're not targeted because they're a smaller business. That's not true.
It's
As
the
soon as they
opposite,
say
right?
that you're help, what's that?
It's the opposite.
Yeah,
You're the easier fruit. And
exactly.
yeah.
Exactly. They know you don't have everything in place. So they love to hit the smaller just as much as they love to hit the bigger ones. It's
Hmm.
less work if they hit the smaller ones, 100% of the time.
Hmm.
And then what we talked about earlier, children's medical records are 10 to 20 times more valuable. There's more things that they can do with it versus adults' information. Especially like insurance will cover like credit auditing when you do get hit to watch it. Typically, they cover it for 2 years. So again, they like to hold on to the information for about 3 years, ransomware attackers, so that they
Hmm.
can then use that information. But I don't know many adults that have their kids on credit monitoring. And so again,
Right.
they're 18, they're trying to get a loan for school and they're getting denied because again, their credit is absolutely destroyed.
Scary stuff.
Absolutely. And then, like I said earlier, and I'll keep reiterating this, it's only getting more aggressive. In the
Hmm.
stats here, you can see in 2009, it was about zero. Now in 2024, I mean, it's most Americans. You're looking at 270 something million Americans affected by this, which is pretty much the entire population. We're almost there. And so it's not going anywhere. It's only getting more aggressive. And that's a big thing that I have to do a lot of education on. We have these chiropractors that have been practicing for decades. And they're like, I've never had to worry about this before. Why do I need to start worrying about it now? Well, it's
Yeah.
fairly new. I mean, it's only about, in the grand scheme, like it only got aggressive about 10 years ago, even less than that.
Hmm.
And so this is something that's new. And again, there's more new tech that's coming out that's really causing a lot of disruption across the board.
Yeah.
So again, this stat just shows where the trend's going. And as you can see, it's a straight up arrow right now. Yep.
Hmm.
These are how HIPAA breaks up the fines. And so you have four tiers in total. So tier one, you're looking at per violation is 141 to 71,000 is the per violation. Now they can bill up to a little over 2 million per year.
Hmm.
So if you don't take like this is when you plead ignorance is tier
Hmm.
one. When you didn't know, they'll do the fine, and typically they'll go into tier two if you didn't fix what led you to tier one.
Yeah.
So you have a certain amount of time, whether that's 30 days, 90 days, before they come back in and audit and ask, hey, did you fix this? How did you fix it?
Yeah.
When you get into tier two, it jumps up to that 1,400, up again to that 71,000. And then tier three is willful neglect. These are things that they may deem, and again, it depends on who's auditing you and if they like you or not. So there is
Mhm.
some human aspect to this as well. But willful neglect are simple things that you should have in place. And again, if you get hit there, you're looking at again about the 14,000 to the 71,000. And then tier four is if you haven't made those changes within a 30-day period of discovery, then again, you're jumping up to that 2 million mark there.
Mm,
I'll
mm,
talk
mm.
about this on the insurance slide, but these are not covered by cyber insurance. These can't be covered by insurance. These are fines. So again, you can be hit with these and you have no way of paying it except out of your pocket.
Yeah, that is tough.
It is. So misconception number one, I hear this a lot. Cybersecurity insurance will save us.
Hmm.
So they're still, in my opinion, still trying to figure out cybersecurity insurance. I mean, I had a chiropractor friend ask his rep, okay, I want cybersecurity insurance. And they'll tell you how much it costs per year, but then they don't tell you what's really necessary to actually get that coverage when it comes time. 40% of claims get denied, and that number's only climbing. So the number you really want to avoid is the $50,000 claim or higher.
Yeah.
That's when an audit comes your way. Now, there's a few things that they look at when it comes to the audit. First off is your risk analysis, because most insurance they do require that you submit a risk analysis to get the insurance. If you lied on that and they find it, you're done.
Hmm. No
That-
coverage.
No coverage.
Hmm.
Second thing they'll look at is multi-factor authentication. That reduces risk a lot. Now, this is where people get confused. They have it on their EMR system. A lot of them do have the two factors. Some don't, but a lot of them do. But you also need it on your computer. Reason being is anytime you download a file that has PHI on it, it's on the computer. Even if you're moving it to the EMR system, it's still on the computer. Still, if you delete it, it's on there. Like you really can't get rid of things.
Yeah.
So the two-factor authentication has to be both on the EMR system and also on the computer itself. The other thing that they look for is audit logs.
Yeah.
Every single person needs their own individual login.
Hmm.
So The FBI has been taking this very seriously, and they created a group called CISA. Each state has their own CISA um, office. And so, what CISA wants to see, the reason why FBI got involved with this is because there's a lot of terrorist groups that are focused on cybersecurity now and
Hmm.
getting American information.
Yeah.
And so they want to know where it's coming from, and they basically need a roadmap of where to follow it, and you have to be able to show where it came from. And when you don't have an audit log, meaning everyone has the same username and password, or people are sharing a username and password, then again, you're failing when it comes to the cybersecurity insurance.
Hmm.
Right? They're not going to cover it if there's not a way to actually track how you were hit. So again, claims are denied even in the best practices. Again, it's about 40% right now plus, and it's only going up from there. And then, like I said earlier, there's a little bit of misconception on what they're going to cover. So they'll cover your downtime. They'll cover like any kind of ransomware. Now, the funny thing though is they like to negotiate, which is funny because we're not allowed to negotiate with terrorists, but apparently insurance companies can. And so they'll negotiate on your behalf to actually decrease that ransom. Um, but that still requires time. And so again, that's where that 19 days of downtime can still play a factor because your insurance won't do a payout until they come to like a settlement pretty much when it comes to the ransomware.
Hmm.
Um, and then again, if you have any fines from the OCR or the HIPAA office, those aren't going to be covered by your insurance. And still, you're looking at hundreds of thousands of dollars still out of your pocket, even if you have the cybersecurity insurance and you also get the claim covered, which are two big things that you have to get through first. You
Hmm.
still are going to get hit with costs. You still need to let your patients know, especially if it's over 500 patients. This depends from state to state, but you also have to post it publicly. There's usually like again, news now. If you look at someone's name, you can find articles where they were hacked. So it affects patients' trust. You lose patients. There's reviews. And then even there's a possibility for lawsuits as well. If you were responsible for a patient's information, a patient can come after a practice for losing their information.
Oh yeah.
And so there's a lawsuit component that you need to take into consideration there.
And and not only that, your operations can stop. I mean, I've had
Yeah.
people have their database held hostage. That's your scheduling. That's all of your notes. You've got personal injury cases that are open and pending,
Yep.
and you can't access the records, right? You don't know who's going to come in on the schedule because
Yep.
there's no schedule. So who are you going to recall? Because the phone numbers are in the database. So
Exactly.
it is something that an ounce of prevention can help you avoid a whole pound of pain.
Absolutely. Absolutely. And that kind of goes into my next point is a lot of people think their EMR system handles their cybersecurity. The EMR system handles their own cybersecurity. They have to meet certain standards. And so, again, there's certain certificates that they actually get. Every EMR system has, and you can ask them for that. But they have to meet certain standards to actually be able to hold patient information.
Hmm.
Now, the misconception there is okay, if I get hacked, I can still get into my EMR system or my EMR system does the backup. But you have to keep in mind most EMR systems are cloud-based. And so you can still have the road from your computer to the internet to the EMR system blocked. So even like locally here, Ascension Hospital, they have Epic, which is the highest level EMR system out there.
Yep.
And so Epic didn't have the issue, but they weren't able to access Epic. All their computers, all their Wi-Fi was blocked from accessing that. So again, you still can't access it. It's still there, but
Mm.
the EMR system's not responsible for your cybersecurity. They're responsible for their own system. And so again, that's another misconception that people have. Or sometimes I even know of this situation, and I think we both know of this situation. The backups weren't done. Like the EMR system didn't have their backups. And I know of a chiropractor that lost all his patient information
Yep.
because the EMR system didn't have the backups there. The other thing to keep in mind is if a hacker gets into your system, you may not know when they get into your EMR system. Well, you're the one responsible in that transaction because they came through your system.
Right.
And so the EMR system is not responsible for that. They'll isolate your practice, and that creates a whole slew of issues as well because they're there to protect themselves. They're
Yeah.
not there to protect you. They're just a storage unit pretty much.
Yep.
Yeah. Let's see. So yeah, with this as well, human error plays the biggest factor.
Mm.
80% of the time, it's human error. Clicking the wrong email. It can even be an IT provider and how they have you set up. Human error plays the biggest factor when it comes to actual hacking. It's very easy to do social manipulation. We've talked about phishing before, and most people still think of phishing as, the prince in Africa saying, "I have $5 million for you. Yeah, just claim it." And it's gotten a lot more sophisticated than that.
Oh,
You
the
have something
email comes from somebody you know.
direct with like one little change, or even
Yes.
phone calls now
Yep.
come from the number, have the voice because of the AI.
Sure.
And yeah, I mean, I've had personal friends where their dad or brother called them from jail and saying, "You
Hmm.
have to send money so I can bail myself out." And luckily, a lot of them hang up and then call their actual parent or brother. And like,
Right.
"What are you talking about?" So again, it's just gotten a lot more sophisticated. Even like, so there's phishing, which is your generalized, and then you have what's called vishing with a V instead of a PH.
Hmm.
And these are targeted focused. So again, like you said, it's email from someone you know where it's a, capital I instead of an L,
Yeah.
or a one little thing tweaked or changed. And you get that email and you think it's from a patient, you think it's from another doctor. You click it and it's over. And that's
Uh,
the scary part. It's just one click. You click one thing and you lose your entire system.
Totally. And there's one going around right now, which are an Evite. So, Evite is you get invited to somebody's party and it's click on the invitation and it looks like the invitation and it looks like it's from your friends
Mhm.
and you're about to click it and then you go, well, maybe they would have told me about this or
Yeah.
something. It's don't click it. Don't
Yeah.
click it.
Well, even with Gmail, sometimes you don't see the email, you just see the name of the person,
Yeah.
and you
Yeah.
can
Yeah.
have the name of whoever. And so you got to check the actual email, like the at Gmail or what have you.
Right.
So yeah, little things make all the difference.
Hmm.
And then third misconception, our IT provider has us covered. I
which
know a
which
lot of
most people
chiropractors.
think. That
Yes.
totally my IT guy. That's what I hear most often. Oh, my IT guy's got this.
Yes, they are two different degrees. Like cybersecurity is very certification based. And
Mhm.
don't get me wrong, IT is important, but IT is like your computer is down, let me get it back up. Cybersecurity is your computer's down, let's figure out why, because there might be something underlying there.
Mhm.
So IT is like your oil check, engine lights comes on, stuff like that.
Mhm.
Cybersecurity is your brakes. Like that is your brakes, your airbag, everything along those lines. And IT, they have very specific wording in their contracts. Like again, they're not focused on the HIPAA compliance. They're focused on computers running and doing what they're supposed to. And so
Mhm.
cybersecurity, even if you have IT, is layered on top of that IT. So it
Yes.
makes again all the difference there. And the stat here is 43% of healthcare breaches involved IT misconfiguration or oversight. So, example would be a lot of people have what's called Windows Defender. It comes with your computer.
Mhm.
It's your firewall. That doesn't actually meet HIPAA standard. There are very specific firewalls and standards that have to be met. and your IT will set you up with that firewall. But again, when it comes to HIPAA, when it comes to actually getting covered, you have to have certain level of configuration and encryption on any PHI. And that's just not trained with IT.
Mm-hmm. For sure.
So what can you do as far as your practice is concerned? So there's three things when it comes to, there's three categories when it comes to HIPAA. You
Okay.
have your physical, your technical, and your administrative, and each of them are important. I'll
Hmm.
talk on probably the simplest one is physical.
Okay.
So those are your two locking doors. That's if you have a printer that's end of life or a computer that's end of life where it's no longer supported and
Hmm.
you have to actually get rid of it. So you have to take it to a shredder. You have to have it like a HIPAA compliant shredder where they give you a certificate that's been destroyed completely. And you have to have that on file for 6 years. And again, your state may vary. Like for Indiana, it's 7 years, but HIPAA overall requires 6 years.
Hmm.
Has to stay on file. So that's physical, which is usually the easiest to meet. Then you have your administrative, which again, your office manager usually handles quite a bit, but typically it doesn't meet the standards. There's a lot of procedures that HIPAA requires that you have to have written out. That's, your risk analysis done yearly. That's your policies and procedures. That's your incident reporting. So if something does happen, not if, when, but when something does happen, you have to have documented how you're going to handle it,
Hmm.
who is in charge of what, and how quickly you're going to get back up. And now HIPAA requires a 72-hour policy. You have to be back up and running within 72 hours, and you have to have that tested. And so, again, the administrative is very policy and procedure, but HIPAA cares highly about that. They don't care about perfection per se. They care about if you're moving towards that.
Yeah.
And administrative really makes that difference. So you can have something that on your risk analysis that you haven't completed yet or taken care of yet, but as long
Hmm.
as you have notes of this is our game plan, this is when we're going to do it, that's what HIPAA cares about. And as long as you're still following that,
Yeah.
that's what they look for. And then technical, that's where a degree really comes into place. Like that is your encryption. You have two types of encryption. You have encryption at rest and encryption in transit. So
Hmm.
whenever you send an email or send something to a patient, it has to be encrypted. And then also when it's just sitting on your computer, it has to be encrypted as well. That's your backups. So you have to have data backups. Again, your EMR system usually has backups for them, but you also have to have backups for your computer, so on and so forth. And that's where a lot of the redundancies come into play on the technical side. So the risk assessment and documentation, that's your administrative side. If you're not doing anything, I would definitely start with your risk analysis.
Yeah.
Breakthrough has a great form for that. You start there. You need to identify what you don't know,
Hmm.
and it walks you through that.
So it's risk of penetration, risk of
Yeah.
somebody getting in to your data. That's the risk.
Yes.
Yep.
Yep. Exactly. And you have to document like how right now, if you haven't addressed it, when you're going to address it, like I talked about, why it's not addressed, so on and so forth.
Hmm.
Then your endpoint monitoring and staff training. So endpoint is more technical. Your staff training is administrative. At least once a year, you have to have your HIPAA training. You have to have people sign in for that. You have to have that on file for, again, 6 years at a minimum, according to HIPAA.
Hmm.
So again, you need to show um, that there isn't negligence on that end. Because if a employee is trained and they cause an incident, it takes a lot more of the pressure off of the practice. You still have responsibility, but that responsibility also falls to that individual if you have the training as well. So it takes a little bit more pressure off of the fines.
Yeah.
The backups we just talked about, again, you have your cybersecurity and HIPAA integration. So making sure that the brakes are working, all of that. And then your incident response planning, which we talked about as well, which falls into the administrative. So core steps. So the risk assessment, like I said, that's on Breakthrough. Make sure that you're doing that. Yeah, I did that picture there.
I love it.
It's overwhelming. Don't get me wrong. And that's why
Yeah.
I started this company is just really to help people. At the end of the day, that's what we're here for. And anyone that's listening to this, even if you have, a single question, and there's no such thing as a silly question when it comes to protecting your way of life. This is your how
Yeah.
you provide for your family. This is your legacy. I implore you to take this very seriously because, like I said, it's just one click. We do thousands of clicks every day, and
Yeah.
just one can derail your entire career. So identify the vulnerabilities, meet the HIPAA requirements. You can find that on Breakthrough's website. The endpoint monitoring and the staff training, do that if you haven't. Start documenting it now. Make sure that you're really diving into that. And there's great resources there. I mean, there's YouTube channels that talk about it. Doesn't have to be, there's no curriculum per se, but you have to have it shown what you're teaching. And then again, everyone's signing off on that.
Mhm.
Ensure recovery even during ransomware. So making sure you have those backups, talk with your EMR system. They usually have their own cybersecurity team, so you can really get a lot of info from them. You just have to ask the right questions. Incident response planning, like I said, it's you need to know exactly who does what if an incident happens and have that documented. And then the cybersecurity, just beyond IT, it's compliance and prevention combined.
Mhm.
Okay. This is just like a regular case study. All it takes is, one phishing email, one phishing email, staff clicks it, hacker gains access. In a week, they can get, depending on your system and how sophisticated it is, they can move really quick.
Oh yeah.
They love to see like a healthcare practice and they know they have to move quick on it. So making sure that's taken care of. But week one, your EMR is locked, appointments canceled, you can't take payments. I mean, any company across the board needs cybersecurity. I just hyper focus on healthcare because it's number one focus. But
Mhm.
any person taking payments has to have some aspect of cybersecurity.
Mhm.
Week three, again, you're looking at that 19-day average, still down. You got the investigation begins because you need to let them know. I know some docs that don't let the OCR office know if there's an incident. That's a big no-no. There's no statute of limitations when it comes to this. If you ever get audited and you have had an incident happen and you didn't report it, I can promise you're looking at tier four
Yeah.
at
And
least.
and guys, OCR is Office of Civil Rights. So the protection of your private health information is considered a civil right.
Mhm.
So that's the people who are the HIPAA police are the Office of Civil Rights. So when you
Yeah.
get into a situation, we talk about the fines and penalties. That's why they are so significant, right?
Yes.
And all the way up through to and including jail time.
Yes.
So serious stuff.
Yeah. Yeah. If they showed serious negligence on your part, you didn't report anything along those lines, it jumps up there. And like you said,
Hmm.
it can lead to jail time and not only loss of practice. So
Hmm.
and then yeah, outcome again, you're looking at, 250,000 in costs, patient trust loss, staff turnover. There's a lot of things that can happen when it comes to an incident like this. And like I said, that 50,000 mark is where the cybersecurity insurance will do a pretty thorough audit at that point.
Hmm.
So again, cybersecurity is just not at this point an option. It's not optional. It's something that is required. I know a lot of docs have been practicing for a long time, and this is something new, and this is a standard of practice that has to be met at this point. It's important that you protect your patient's info. It's important that you protect yourself in the practice. And I've said this from the get-go. This is not something that's going away. It's
Right.
only getting more aggressive. I talked about AI a little bit, but even AI, hackers are having them go and test, basically poke Wi-Fi signals and really look for ins. And as soon as the AI finds that, then you have the hacker looking into it. They see it's medical and they love that.
Hmm.
And it just, again, it's the number one focus. Now, I know a lot of people aren't taking Social Security numbers anymore, which is good. They can have patients opt out of that, but still, even in the medical realm, you have the most info when it comes to a patient. One thing um, that I've seen is what they love to do is they'll sit on your system, they'll look up certain ICD-10 diagnosis codes. This happened to the hospital. They looked for heart patients and they started billing on behalf of the hospital to these insurances like Medicare for
Yeah.
catheters. And then
Yes.
they get the payout and the hospital is getting like dealing with um, falsified claims
Right.
when it came to Medicare. And so there was a whole court issue that
Big
happened.
scam last year. Yeah.
Yes.
Big one.
Yep. So that's something as well. If you have insurance information on the EMR, they would love to get that info because they can start billing on behalf of you, and that causes a whole another type of audit.
Yeah.
You know, a hospital can dodge that or like work that out, but again, on a smaller business level, it's a lot harder.
Yes.
Yeah. All right. Well, that's everything that I know. I threw a lot of info out there, but again, if questions do arise, we are on Breakthrough's website. You can also go to www.cy-hive.com.
And John, I wanted to mention just briefly because I
Yeah.
do know that as a courtesy to Breakthrough Coaching members, that you do offer an analysis for them, right?
Yes.
That's a big deal. Could you tell folks a little bit about why they'd want to do that and what that looks like?
Absolutely. So, just the same way that you do with your patients, you do a report of findings, and this is the same thing, and you can use it for your risk analysis.
Hmm.
Like we go through the practice, we look at your computers, and we document anything that doesn't meet the standard. We show what law that has to be, the law that's associated with that as well, and then a mitigation plan for you too. So even if you don't use us, like I've told plenty of practitioners, hand this to your IT department. If they're like, we don't do this, then we can have a further conversation. But end of the day, again, this is bigger than, me making a buck. Like this is protecting people, kids, and business owners, and that's what I'm here for.
Better believe it.
Yeah.
Well, John, I appreciate it. Uh, those of you who are listening, I encourage you greatly to take advantage of this offer. This is not a small thing. This is a big thing that John's offering to do for you. And those folks, again, I I don't know how many you've done, but I know it's been a lot. And I don't know that there's one yet where there hasn't been a very significant vulnerability
Yeah.
that has been uncovered that they just weren't aware of. And
Yes. You don't
so,
know what you don't know. I mean, I went to one chiropractic office and they had their firewall turned off. And I'm
right.
like,
Yes.
let's just hit this button and turn this on. I don't care if you go with us, just let's turn this on.
Right. It's true.
Yeah.
Oh boy. Well, listen, I know this is a serious subject, and we're here to help. John and his team at Cy Hive are there to help you. Please get the contact information right off the Alliance Partner page on the Breakthrough Coaching website, and schedule your analysis with them. That's something you'll be very, very happy you did in the new year. John, thanks so much.
Thank you, Mark. I appreciate it.
And this is Dr. Mark Santa, another level up in the can. Hope that you make today an exceptional day. We look forward to seeing you next time. Bye bye.